Would you know if your dog was in trouble? There are signs that might look minor, but are actually serious red flags. In this video, I'm sharing 10 specific symptoms that every dog owner should be aware of. These aren't just ordinary signs. They can indicate dangerous health problems. By the end, you'll feel confident knowing the signs to watch for, giving you the chance to act before it's too late. Number 1. Changes in breathing pattern. Think about this. Would you notice if your dog's breathing suddenly became slower, shallower, or faster? Dogs breathe between 15 to 30 times per minute when they're calm, but a consistent change could be a warning sign. Rapid, shallow breaths could signal respiratory infections, while slow or irregular breathing might point to heart problems or even pain. It's best to check your dog's breathing when they're relaxed, as this helps establish a baseline. Try this. Count their breaths when they're sleeping. Is it within the normal range? If their breathing is labored, open-mouthed, or faster than usual, it's time to take action. Number 2. Pale or bluish mucous membranes. Here's one question for you. Have you ever checked your dog's gums? It sounds unusual, but the color of your dog's gums can give immediate insight into their blood circulation and oxygen levels. Most dog owners don't think to check, but it's one of the quickest ways to identify internal problems. Healthy gums are pink, while pale gums may indicate anemia or blood circulation problems, and bluish gums suggest oxygen deprivation. It's simple to check. Lift their lip and gently press on the gum to see if it returns to pink within a couple of seconds. This color change is called capillary refill time, and it can signal how well your dog's blood is flowing. If their gums stay pale or have a blue hue, don't wait. Consult your vet immediately. Number 3. Unusual changes in pupils or eye color. Have you ever noticed changes in your dog's eyes? We're talking about small differences in pupil size, cloudiness, or color changes. This might sound minor, but it can actually point to serious issues like neurological problems or increased pressure within the eye. Unequal pupil sizes could suggest head trauma, while cloudiness might be linked to eye diseases or infections that can progress if left untreated. When you're with your dog, take a moment to look at their eyes in good light. Are their pupils symmetrical? Any changes like this should never be ignored, as they could indicate bigger health concerns. Number 4. Unusual swelling or warmth in the abdomen. Have you ever touched your dog's belly and felt it warmer than usual? Or maybe you noticed a bit of swelling that seemed odd. This is one symptom that can easily be overlooked as a full stomach, but it could be a sign of something much more severe, like internal bleeding or even bloat, a condition where the stomach twists and cuts off circulation. You can feel your dog's belly to check for any unusual tightness or warmth, especially if they show discomfort when you touch them. Dogs experiencing abdominal issues may whimper, avoid lying down, or act restless. If you notice these signs, especially with visible swelling or warmth, it's critical to see a vet as soon as possible. Conditions like bloat can be fatal within hours, so never hesitate if something feels off. Number 5. Limping or favoring a side without visible injury. What if your dog suddenly started limping, but there's no visible injury? This might seem like a minor issue, but limping without apparent cause can be a clue to internal pain, joint issues, or even neurological conditions. Watch for small behaviors, like if they avoid putting weight on one leg, hesitate before jumping, or are reluctant to climb stairs. Limping can sometimes mean pain deep in the joints or spine, and even though it might not look serious initially, recurring limp should be checked by a vet. Consistent limping could lead to bigger issues if left unchecked. We're halfway through the list, but some of the most surprising symptoms are still ahead. Stick around, because the last few symptoms could completely change how you understand your dog's behavior. Number 6. Frequent nosebleeds or unusual discharge from the nose. If you saw a little bit of discharge or even blood from your dog's nose, would you think it's harmless? Actually, nosebleeds in dogs are almost never a good sign. Frequent nosebleeds could be symptoms of respiratory infections, blood clotting issues, or, in rare cases, nasal tumors. Keep an eye out for any discharge that's not clear, especially if it's blood-tinged or has an odd color. This is definitely one sign that shouldn't be ignored. The presence of blood often signals something deeper going on, and catching it early can help get your dog the treatment they need. Number 7. Inconsistent ear positioning or persistent head tilting. Have you ever seen your dog tilt their head to one side frequently or hold their ears unevenly? It might look cute or quirky, but if it's persistent, this could signal inner ear infections, balance issues, or even brain-related conditions. When a dog has an ear infection or neurological problem, they often tilt their head to balance themselves. Other clues include disorientation, unusual eye movements, or a foul smell from the ear. So, if you catch your dog doing this repeatedly, it's best to get it checked out by a vet. Number 8. Sudden aggression or behavioral changes. Think about this. What if a dog who's usually friendly suddenly starts growling, snapping, or hiding? This might seem like just a mood swing, but sudden behavioral changes can actually mean your dog is experiencing internal pain or discomfort. Dogs are known to hide pain instinctively, so when they act out or isolate themselves, it's often because something is really wrong. Be on the lookout for this type of behavior, as it can often point to neurological or serious internal conditions. If your dog shows persistent behavioral shifts, especially aggressive ones, it's worth discussing with a vet. Number 9. Difficulty in eating or swallowing. Ever notice your dog struggling with food, like they're chewing on one side or seem to hesitate before swallowing? While it might seem like simple pickiness, difficulty in eating could mean more than that. Dogs who struggle to chew or swallow could be dealing with dental disease, mouth infections, or even throat tumors. Watch for things like drooling, food dropping, or gagging when they eat. These can all be signs of pain or a blockage. If eating seems harder than usual for your dog, don't ignore it. Get it checked. Oral health is directly connected to overall well-being, so addressing it early can prevent bigger health issues. Number 10. Excessive licking of paws or other areas. And finally, one of the most overlooked signs. Does your dog constantly lick their paws or another specific area? Dogs lick themselves to soothe discomfort, which could be due to pain, allergies, or even internal issues. Excessive licking is often more than just grooming. It's a coping mechanism for pain or anxiety. If your dog focuses on one spot and licks to the point of creating sores, this is a sign to consult a vet. It might mean an allergy, joint pain, or even something deeper that needs attention. Here is a bonus tip. When an animal's body stops functioning like normal, things can start to smell. This can happen due to kidney disease, metabolism changes, oil buildup in the fur, incontinence, dental disease, or poor grooming. You may notice that your dog has a different or stronger odor than usual near the end of life. How you can help? If your dog likes baths, gently bathe them with warm water. You may consider using dry pet shampoo to brush softly through their fur if they don't like baths. You may also consider washing their bedding and soft toys and providing them with breath-freshening chew treats.